The risks of participating in athletics. Concussions and other possible hazards by James Kane. Tonight's agenda, we want to cover our mission statement, the potential risks, concussions, other injuries, skeletal injuries, muscle injuries, and sports and their potential impact on academics. First, the mission statement. The mission of this school is to empower faculty and staff in cooperation with parents and community to significantly increase the performance capability for our students to become creative, critical thinkers in order to achieve mastery of established objectives and to promote individual student accountability and the social skills necessary to become contributing members of society through a cooperative and collaborative learning environment. So what's a concussion? A concussion is an injury to the brain caused by an impact to the head. It can cause long or short-term problems depending on the severity. How can you get a concussion? Through contact sports, car accidents, falling, objects hitting your head, any severe jarring of the head. The symptoms of a concussion include an altered level of consciousness, drowsy, hard to arouse, or similar changes. Confusion, feeling spacey or not thinking straight. Headaches, loss of consciousness, feeling like you have lost time. Memory loss of events before the injury or immediately after. Nausea and vomiting. Seeing flashing lights. If you have a concussion, what you shouldn't do: play contact sports, participate in physical education. If very severe or have multiple concussions in a few months, doctor may recommend no TV, no cell phone, no computer. Treatment for concussions: Tylenol for headaches. Eating a light diet, light activity around the house, not too heavy of activity. Avoid alcohol until completely recovered. Most dangerous sports for concussions would be football, ice hockey, rugby, soccer, martial arts, boxing. Sports and concussions. Most concussions come from the sports of football, soccer, volleyball, basketball, wrestling, baseball, and softball. Football, boys basketball, boys wrestling, boys baseball, and girls softball have a significantly higher rate of concussions. Other injuries and risks include skeletal system injuries, such as a sprain. A ligament is stretched beyond its normal point of elasticity. Dislocation, when the bone is pushed or forced out of its place. Breaks, open or compound, when the bone breaks through the skin. Closed breaks, when the bone breaks within the skin. Hairline or stress fractures, when there's a crack in the bone. Complete, which means the bone shatters. Incomplete, not broken completely. Muscular system injuries. A strain is one of the most common injuries to a muscle. It's the stretching or tearing of muscle fibers. A cramp usually occurs when a muscle contracts involuntarily. A muscle tear is a contraction-induced injury in which muscle fibers tear due to extensive mechanical stress. Time management and the high school athlete. Athletics can put stress on a high school athlete. Balancing sports, work, and school can become tiresome. So the management and the high school athlete is a very, very risky situation. In the state of Missouri, athletes must pass 6 out of 7 classes to be eligible for the next sports season. Some athletes need to be taught how to manage their time. How can you help? Read and sign the documents required for your student athlete to participate. Be alert to any warning signs your child may exhibit. Have them checked out if you see any signs of injury. Talk to the school's trainer and athlete's coach with any concern